We received money from the Urgent Needs Fund to purchase diapers and formula to help the young families in our communities that needed it. So we did outreach to a lot of our families. We work at the health department with a lot of young moms, along with pregnant moms and moms with babies, so they see us as a resource. They come to us for their WIC services. They get benefits they can use at the store to buy formula that they need. And when they couldn't do that, when they would go to the store and the formula would be all gone because of panic buying and it wasn't available and they didn't know what to do and they were scared, they would call and talk to us. The award made a difference in our organization because we were getting phone calls from moms asking if they could start their babies on regular milk earlier because they didn't have the money to get the formula that they needed or they couldn't find the formula in the stores. So this was what we saw as a need to be able to support these moms so they could stay on formula. We had community health workers who were able to drive and deliver supplies to the moms on their porches. And the other part of that is because we were able to provide that concrete need that they had, they also asked about other things. I had one mom in particular who she called me 3 different times, and the first time we were able to give her the formula that she needed. After that, she called just because she had so much going on in her life and she was scared, and she knew that it was a trusted source that she could call and ask questions about. So we ended up signing her up for home visits that we could do later. We met with her on the porch and were able to talk her through some things. Got her referred for her physician. She had some postpartum depression going on, and so we were able to help her get connected with the resources that she needed. And if we hadn't had that initial reach out and connection with the formula, she might not have thought to ask us. If we hadn't received the grant to be able to share with the families, there would have been babies who were getting formula that was more diluted down than it was supposed to be because they were trying to make it last longer. Babies that would have been fed other milk or other things that they shouldn't get when they're really young because moms didn't have what they needed. There could have been health consequences related to that even. For me personally, it feels really good to be able to help people. That's why I became a nurse in the first place. And it's really hard if you don't have resources to give to people that you know are struggling. Being able to do those porch drop-offs, and I did 8 of them one day myself, and have those moms come out and the great big smiles that they had and the relief, I felt like Santa Claus. I mean, I felt like I was, their guardian angel coming in, fairy godmother, to be able to help deliver what they needed. And it felt really good to be able to do that and be able to help in a real time of need.